Every morning when the first rays of sun kiss the forehead of verdant heights and the lilting songs of birds coast through the expanse of this wondrous vale, an inspiring sense of beauty and grace overtakes virtually every speck of life here, which is exactly when one remarks with deep awe and admiration, "Wow, Jammu and Kashmir is indeed unparalleled." The natural wonders of the state have been held in high esteem for centuries together. However, one needs to essay a slightly closer and more patient observation to realize that Jammu and Kashmir has established commendable parallels over the years in the sphere of human development as well. Different welfare schemes launched by the central and state governments to effect path-breaking changes in the lives of people here are showing encouraging results and paving the way for many more salutary developments. One such scheme is the centrally sponsored Comprehensive Health and Family Welfare Scheme, NRHM, National Rural Health Mission.
National Rural Health Mission is a very ambitious program started by Government of India. It's one of the flagship programs that we are implementing in the state of Jammu and Kashmir. This program has some very meaningful interventions. Not only it provided us with sufficient funding to implement those interventions, but the quality of those interventions were very important. Through National Rural Health Mission, we have focused on various very important health parameters, which are the indicators of the health index in the state. If we talk of the focus areas of NRHM, they have been mother and child care, safe motherhood, then safe childbirth, then controlling infant mortality rate, then focusing on neonatal mortality rate, and then accordingly focusing on other areas like school health programs, adolescents programs, primarily targeting the rural population of the state.
NRHM is actually a countrywide health program aimed at making radical changes in the rural health sector, with special focus on 18 states which have displayed weak public health indicators. Ever since its launch in Jammu and Kashmir in 2005, NRHM has been registering key impressions on different facets of rural health sector by making the relevant institutions and facilities appropriately responsive and responsible to a range of demands and requirements. Traditionally, people belonging to rural areas have had to travel long distances to access health facilities. Such poor access would often result in deterioration of patients' condition and even death. NRHM focuses on making reliable health facilities easily available to rural population and, more importantly, works for a worthwhile alignment of interests between common people and the health department. This is ensured by involving panchayat representatives in the formulation of village health plan and its subsequent execution. Such an objective approach has yielded satisfactory dividends over the years. Essentially, NRHM focuses on making the rural society healthier and happier by strengthening its two key pillars, mother and child. In this direction, the mission operates courtesy two important initiatives, JSY or Janani Suraksha Yojana and JSSK or Janani Shishu Suraksha Karikram. As the name suggests, JSY, that is Janani Suraksha Yojana, is targeted at making mothers' health better. Traditionally, untrained midwives would perform the task of child delivery, a fact that resulted in a high mortality rate both in mothers and newborn children. JSY or Janani Suraksha Yojana has actually been conceptualized to address this very problem. The scheme puts a premium on promotion of child deliveries in hospitals, thus ensuring adequate care and treatment for mothers and newborns. Janani Suraksha Yojana is proving a boon for mother-child health in particular and the health of society in general. For a more effective implementation of the scheme, the Health Department works in tandem with Social Welfare Department and provides necessary care to mothers through Anganwadi centers as well. Almost 4,25,000 mothers have benefited under Janani Suraksha Yojana till date, and the benefits continue. As regards JSSK or Janani Shishu Suraksha Karikram, it is targeted at both mother and child, pregnant women and newborn children to be specific, and ensures completely free treatment and free provision of other facilities to both. Since the inception of this scheme, more than 87,000 normal deliveries, almost 34,000 cesarean section deliveries, and care to almost 18,500 sick newborns has been ensured.
If you see the data in those performance review document and compare it for last 3 years, there has been increased in OPD of health department. That means it includes all starting from sub-center to district hospital. There is increase of 53%. If we see the indoor patient increases almost about 85%. And then the institutional deliveries in the peripheral institutions have improved, which means the referral to the higher centers like medical colleges had decreased. It has improved by 30% in last 3 years. Until you have the participation of people, you can't implement the schemes, especially a scheme like NRHM, which is meant for the rural people. Here the involvement of the community is must. So what we have done is we have done a lot of homework on it. You must be knowing that we have in the National Rural Health Management program village health, sanitation and nutrition committees, and then we have provided them 10,000 rupees per committee as an untied fund for utilization of the services like provision of sanitary services in the village, cleaning of the drains, wells, water sources. So we have tried to involve the community in planning of health also. Village health plans are also being made by the village health, sanitation and nutrition committees. So overall, I think until we have the participation of these community, we cannot go ahead.
NRHM does not just believe in beginning the flow of its benefits at the time of child delivery. The mission stays faithful to an expectant mother right from the time of conception and ensures constant track of the progress of a pregnancy and requisite intervention through a huge network of ASHAs or accredited social health activists. ASHAs work in close proximity with expectant mothers and ensure all possible care for them. Almost 11,000 ASHAs are actively working under NRHM in J&K state. In order to make NRHM holistically beneficial, fresh recruitment of staff has been made at different levels. Almost 5,000 personnel have been engaged thus, which include specialists, MBBS doctors, Ayush doctors, paramedics, and program management staff. Such recruitment was immensely necessitated to cater to the needs of new facilities as well as consolidation of facilities already in place, like conversion of almost 200 PHCs to 24/7 level. The creation of some significant facilities like special neonatal care units has also proven a big shot in the arm for NRHM and afforded it a rounded profile. NRHM ensures consistent training and skill upgradation of its staff so as to help them stay true to the goals of the mission. The government is more than generous in funding the mission and has released hundreds of crores of rupees till date for the smooth and effective execution of different initiatives coming under its purview. NRHM is not just about provision of better health facilities. It is also about building better health and social consciousness, which is why frequent workshops are organized to create awareness about PCP-NDT Act, so as not just to check female feticide, but ensure a genuine sense of security and dignity for the girl child. NRHM has truly changed the face of rural health scene and promises to move ahead even more zealously in years to come.